are you today?
Good, how are you?
Good. My name's Dana and I'm going to be your nurse. I'm just going to close the curtain for privacy and wash my hands. Alright, so vital signs are already done. Now I'm just going to be doing a full head to toe assessment. So can you please tell me your full name and date of birth?
Edward Tordall, August 6, 1993.
Perfect. I'm just going to look at your wristband. Thank you. And can you tell me where we are?
Ocala, Florida.
And can you tell me the date?
It is August 16th, 2019.
Alright, so patient is oriented to person, place, and time. Posture is good and speech is clear and appropriate for the situation, and patient does have good hygiene. Alright, so now I'm just going to start from the top. Let me know if you have any pain or discomfort. Right, there's no tenderness or lesions in the scalp. Alright, perfect. Now I'm just going to be looking in your ears. Now, do you have any problems with your hearing?
No.
Alright, there's no excess wax or discharge noted. Alright, now what I'm going to have you do is, I'm going to have you close your eyes, and when you hear something, tell me where.
Left ear. Right ear.
Alright, perfect. So cranial nerve 8 is intact. Now I'm going to be looking in your nose, so can I have you look up? Alright, so nares are painted. There's no excess discharge, redness, or bleeding. Alright, so now I'm going to have you cover one nostril with your finger and sniff. Now do the other side. Alright, so cranial nerve 1 is intact. Now I'm going to be checking your eyesight. So if you could do me a favor, just look straight ahead. Perfect. Now look at my pen. Perfect, so pupils are equal, round, reactive to light and accommodation. Now I'm just going to have you follow my pen with your eyes and not your head. Perfect. So cranial nerves 3, 4, and 6 are intact. Now I'm going to have you cover your eye, and when you see my fingers, tell me when.
One. 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 One.
Perfect. So cranial nerve 2 is intact. Now what I'm going to be doing is I'm going to be looking in your mouth. So could you stick out your tongue? All right, wiggle it from side to side. Perfect, from cheek to cheek. Now close your mouth and swallow. Perfect, so cranial nerves 9, 10, and 12 are intact. Now I'm going to have you push your cheek against my hand. Perfect, other cheek. And shrug your shoulders. Perfect, so cranial nerve 11 is intact. Now I'm going to have you make some funny faces. So could you raise your eyebrows, puff your cheeks, and smile. Perfect. Now, I'm going to have you close your eyes again, and when you feel my finger on your face, just tell me where.
Left cheek. Chin. Forehead. Right cheek.
Alright, so cranial nerves 5 and 7 are intact. So now I'm just going to be feeling your lymph nodes. Submental lymph node, submandibular lymph node, tonsillar, preauricular, postauricular, anterior cervical, posterior cervical, and can you shrug your shoulders please? Supraclavicular, and occipital. Perfect. Now I'm just going to have you stick out your tongue and say ah. Alright, so uvula reaches the back of the mouth, mucous membranes are pink and moist, and teeth are intact. Alright, now I'm going to feel your pulses. Radial pulse. Brachial pulse, carotid pulse, posterior tibial pulse, popliteal pulse, posterior tibial pulse, and the dorsalis pedis pulse. Alright, perfect. Now I'm going to have you turn around and lift your shirt and then listen to your lung sounds. Alright, so the spine appears to be straight. There's no labored breathing, use of accessory muscles, and depth seems to be moderate upon breathing. So now what I'm going to do is I'm just going to check for tactile firmness. So when you feel my hands go down your back, just say 99.
99. 99. 99.
Perfect. And the AP to transverse diameter is about 1 to 2. All right, now I'm going to check for thoracic expansion, so just take a deep breath in and out. Perfect, so thoracic expansion is equal. Now when you feel my stethoscope on your back, just take a deep breath in and out. Perfect, now I'm just going to have you turn around and we're going to do the same thing on the front. Perfect. All right, so just breathe in and out like you were before. Perfect, so lung sounds are good. Now I'm just going to listen to your heart sound. So when I do your heart, you can just breathe normally. All right. Second intercostal space, left sternum border, aortic valve. Second intercostal space, right sternal border, pulmonic. Third intercostal space, left sternal border, Erb's point. Fourth intercostal space, left sternal border, tricuspid. Fifth intercostal space, left sternal border, mitral valve. All right, heart sounds are good. So now I'm just going to be checking your refluxes. All right, tricep reflux, bicep reflux, brachioradialis reflux, tricep reflux, bicep reflux, brachioradialis reflux, patellar reflux, Achilles reflux, plantar reflux. Perfect. Now I'm going to have you lay down and lift up your shirt, and I'm going to check for your bowel sounds. All right, and when was your last bowel movement?
About 8 hours ago.
All right. Any pain or
No.
issues? All right, and when's the last time you urinated?
About 2 hours ago.
All right, any pain or urgency?
No.
All right, so now I'm just going to listen to your bowel sounds starting from the right lower quadrant. All right, bowel sounds are good. Now I'm just going to palpate. Let me know if you feel any pain. No pain?
No.
Perfect. All right, abdomen appears slightly round, mostly flat. There's no scars or lesions. I'm going to check your temperature. All right. Skin is warm and dry, not feverish. All right. Check muscle tone. All right, patient is muscular. All right, now I'm just going to have you put your shirt down and sit back up. All right, now I'm just going to check your capillary refill. Perfect, less than 2 seconds. Less than 2 seconds as well. There's no edema. Check for ankylosing. Perfect. Now I'm going to check your range of motion and strength. So could you put your arms out like this? Push up, push down. Perfect. Can you put your arms like this? push, pull, perfect, push in, push out, push, pull, perfect. Now I'm gonna have you put your arms back out again, swing them towards me, away from me, swing them up and down. Can you wiggle your fingers and your wrists? Swing your head from side to side, back and forth. Perfect. Can you move your knees up and down? Extend your legs. Wiggle your toes and your ankles. Perfect. So range of motion is good. Now what I'm going to have you do is I'm going to have you get up and take a couple steps for me. All right, you can take a couple steps back. Now I'm going to have you stand with your arms and legs together and close your eyes. All right, so Romberg test is negative. You can sit back down. All right, so the head to toe assessment is now done. I'm just going to go wash my hands and document my findings. Is there anything else I can do for you?
No, thank you.
All right, hope you have a wonderful day.
You too.